Welcome to Message Engineer, Episode 3, Facility Flow. I am Maureen Shaffer, and thanks so much for joining us today. Why are we talking about facility flow? Well, because which facility your product or service is used in makes a huge difference to clinical and economic motivations, which are critical to lining up a powerful and resonant message. So, let's get into this today. 3 key recommendations for you in building out your facility flow. Number 1, what facility is your product or service used in? Well, go ahead and Google CMS Places of Service. What will pop up is a CMS, the Centers for Medicare and Medicaid Services, code list of places of service. They'll be numbered from 1 to 99 and find the facilities in which you believe your product or services may be used. They'll include the usual suspects such as inpatient, outpatient, and ambulatory surgical centers or ASCs. It will also include such things as independent laboratories, physician offices, telehealth in the patient's home or outside the patient's home, prisons, schools, mobile clinics, inpatient, outpatient rehab, Indian or tribal facilities, rural clinics, public health clinics, and the list goes on. Go take a look. Recommendation number 2 for mapping your facility flow is, how are we going to do this? We talked about patient flow and the patient's flow through the healthcare system. We have overlaid the providers on top of that in episode 2, and now we're overlaying facilities. It's getting complicated. Go ahead and Google, if you don't already have it, mind mapping or visual collaboration software. Some of the more popular ones are Miro, Mural, and if you're in a PC-based environment using Microsoft, Visio. Or go old school and use your whiteboard, Post-its on a wall, or whatever works for you. Number 3 recommendation is, now that you've overlaid the facilities on top of the patients and provider flows, go back and review the patient and provider flows. The reason for this is that sometimes products and services are used in multiple facilities. For example, hips. Hips and knees can be done inpatient, outpatient, or in ambulatory surgical centers. So based on that, are the patient demographics different in those 3 facilities? Are the providers different in those 3 facilities? Are insurance plans and what's accepted different in those facilities? Are there different kind of clinical and economic motivations in those facilities? So go back, review, make sure it's correct, make adjustments and changes, and that's it. 3 recommendations. What facilities? Go look at CMS Places of Service. How to do this? Look at mind mapping or visual collaboration software. And 3, review your patient and provider flow against what you now know about facilities. That is it for Facility Flow Episode 3. If you enjoyed what you heard today, like, comment, subscribe, follow. We'd love to hear from you. And we'll see you next time for Episode 4, Buyer Mapping. Thanks again. We'll see you soon.